As a neurologist, I must warn you that stroke is one of the most dangerous medical emergencies facing older adults today. It strikes without mercy, often in the quiet of night or during the most ordinary moments. Yet its consequences can change a life forever. Every 3 minutes, someone loses their life to stroke, and many survivors are left unable to walk, speak, or care for themselves. Families are forced to carry the weight of long-term disability, and the burden can last for years. What makes this disease so terrifying is not only its speed, but its silence. The brain depends on a steady supply of blood and oxygen, and when that flow is interrupted, even briefly, cells begin to die. In a matter of minutes, a person may go from being independent to facing paralysis or loss of speech. Older adults are particularly vulnerable. With age, blood vessels lose elasticity. Chronic conditions like high blood pressure and diabetes take hold, and the brain becomes more fragile. Yet many people still believe stroke is only a problem for others, or something that cannot be prevented. That belief is dangerously wrong. Stroke is not random. It has causes. It gives warnings. And most importantly, it can be prevented if you act in time. In this video, I will share with you the hidden stroke risks that seniors must not ignore, the signs that demand immediate attention, and the steps you can take right now to lower your risk. Before we begin, I want to hear from you. Have you or someone in your family ever experienced sudden dizziness, facial drooping, or slurred speech that quickly passed? Share your experience in the comments, because your story might save another life by helping them recognize the warning signs before it is too late. 1. What is a stroke in older adults? A stroke, often described as a brain attack, is the sudden interruption of blood flow to the brain. Unlike other organs, the brain cannot survive without oxygen for more than a few minutes. When circulation stops, brain cells begin to die almost immediately. And the longer the delay in restoring blood flow, the more permanent the damage becomes. For older adults, this reality is even harsher. With advancing age, blood vessels become less flexible, blood pressure rises more easily, and the body's ability to repair itself weakens. This means the same interruption that a younger brain might withstand briefly can cause catastrophic damage in a senior within minutes. There are two main types of stroke. The first, called ischemic stroke, occurs when a clot blocks a vessel supplying the brain. This type makes up the vast majority of cases and is often linked to conditions like high blood pressure, diabetes, heart disease, or high cholesterol, all of which are more common in older adults. The second, known as hemorrhagic stroke, happens when a blood vessel ruptures and bleeds into the brain tissue. This form is less common but usually more deadly, particularly in seniors whose arteries have grown fragile with age. Both forms can leave survivors facing lifelong disability, but both also demand immediate emergency care to limit the damage. There is also a condition known as a transient ischemic attack, sometimes called a mini stroke. In these episodes, symptoms appear suddenly, such as weakness, numbness, or difficulty speaking, but they last only a few minutes before resolving. Many seniors dismiss them because recovery seems complete, but this is a dangerous mistake. A transient ischemic attack is often a clear warning that a major stroke may follow soon, and ignoring it can mean missing a chance to prevent permanent harm. The outcomes of stroke in older adults are particularly severe. Survivors may be left with paralysis on one side of the body, loss of speech, vision problems, or difficulty with memory and reasoning. These effects strip away independence and often make seniors dependent on family members or caregivers for even the most basic tasks. The emotional toll is heavy as well, with many patients experiencing depression, anxiety, or frustration as they struggle with their new limitations. Understanding what stroke is in older adults is more than a medical definition. It is about recognizing how quickly the condition can turn life upside down. Each second without oxygen destroys brain tissue, and unlike muscles or skin, brain cells do not regenerate. Recovery is often partial at best. This is why doctors emphasize the golden window of treatment. For ischemic strokes, clot-dissolving treatments are most effective within the first few hours. And for hemorrhagic strokes, emergency surgery may be required within minutes to prevent death. For older adults, whose resilience is already reduced, acting fast is not just important, it is the only chance to preserve function and independence. By understanding the types of stroke and the urgency of treatment, you equip yourself to respond decisively should the signs ever appear. 2. Risk factors in seniors. When we talk about stroke in older adults, it is not enough to describe what happens. We must also understand why it happens. The truth is that strokes rarely come without warning. They are the result of risk factors that slowly build pressure on the brain's blood vessels until one day they give way. Some of these factors cannot be changed, while others are directly shaped by lifestyle and medical care. Age itself is the greatest unchangeable risk. After the age of 50, the blood vessels naturally stiffen, the heart pumps less efficiently, and the body's repair mechanisms weaken. By the age of 70 or 80, this decline becomes even more pronounced, making older adults far more vulnerable. Gender and genetics also matter. Men are more likely to experience strokes earlier, while women often face more severe outcomes once a stroke occurs. A family history of stroke raises the risk because inherited traits may affect the structure of blood vessels or the way the body handles cholesterol and blood pressure. Race and ethnicity contribute as well, with some populations carrying higher rates of hypertension and diabetes, both of which feed directly into stroke risk. But while these factors set the stage, it is the medical conditions common in seniors that most often tip the balance. High blood pressure is the single most significant factor. It silently erodes the walls of arteries, making them weak and prone to rupture or narrowing them until clots form. Diabetes adds another layer by thickening blood and damaging small vessels. Heart disease, especially irregular rhythms like atrial fibrillation, allows clots to form in the heart and travel to the brain in seconds. High cholesterol creates fatty deposits along the vessel walls, narrowing the pathways for blood. Obesity combines all of these problems, driving blood pressure, sugar, and cholesterol higher, while reducing overall mobility. Lifestyle choices compound the medical risks. Smoking doubles the likelihood of stroke by accelerating vessel damage and increasing clot formation. Excessive alcohol not only damages the liver, but also disrupts heart rhythms and raises blood pressure. A sedentary lifestyle deprives the heart and vessels of the benefits of circulation and exercise, while a diet heavy in fried foods, processed snacks, and animal fats slowly clogs arteries. Stress and anxiety, often overlooked, flood the body with hormones that constrict blood vessels and elevate blood pressure. Loneliness and depression, common in older age, also contribute by encouraging unhealthy habits like overeating, drinking, or neglecting medical care. These risks do not exist in isolation. They interact, multiplying one another's effects. An older adult with high blood pressure, who also smokes and avoids exercise, carries an exponentially higher risk than someone with just one of those factors. That is why prevention must be comprehensive. It is not enough to treat one condition while ignoring the others. For seniors, recognizing these risk factors and addressing them systematically is the key to lowering the likelihood of stroke. Understanding the risks is not about fear. It is about clarity. By identifying what can be changed, older adults and their families can take steps to protect the brain before disaster strikes. 3. Warning signs in seniors. Recognizing the warning signs of stroke in seniors is absolutely critical, because every minute of delay costs brain cells that can never be replaced. Older adults often face additional challenges in noticing or reporting these signs, which makes awareness among family members and caregivers even more important. The most common and classic warning signs involve sudden changes in movement, speech, or vision. A senior may suddenly find that one side of the body feels weak or numb, especially the face, arm, or leg. A smile may look uneven. An arm may not rise when asked, or a leg may drag unexpectedly. These are not signs of tiredness. They are red flags that the brain is losing blood supply. Speech changes are another hallmark. The person may suddenly slur their words, be unable to form simple sentences, or struggle to understand what is being said. Even brief episodes of confusion or garbled speech are serious. A simple test is to ask them to repeat a short phrase. If they cannot do so clearly, treat it as an emergency. Vision problems can also appear. Seniors may suddenly complain of blurry sight, double vision, or complete loss of vision in one or both eyes. This can happen abruptly and without pain, which is why it is often ignored. Loss of balance is another major sign. If an older adult suddenly stumbles, feels dizzy, or cannot coordinate movements, it may indicate that areas of the brain controlling balance and coordination are being starved of oxygen. Severe headache, particularly if it is sudden and different from previous headaches, is especially alarming. Known as a thunderclap headache, it can signal bleeding inside the brain. Nausea and vomiting may accompany this, and in seniors, the onset can be rapid and overwhelming. Additional warning signs that appear frequently in older adults include sudden confusion, changes in alertness, in fainting, or even seizures, loss of bladder or bowel control, sudden drooping of one eyelid, or difficulty moving the eyes can also be stroke indicators. Because seniors often live with other chronic illnesses, these symptoms may be mistaken for fatigue, aging, or medication side effects. That is why it is essential not to dismiss sudden changes, even if the symptoms disappear within minutes, as in a transient ischemic attack or mini stroke. They must be taken seriously. A mini stroke is a rehearsal for a major one, often occurring days or weeks before the real event. The golden window for treatment is extremely short for ischemic strokes. Clot. Dissolving treatments work best within 4 to 4.5 hours. And for hemorrhagic strokes, emergency care must be delivered within minutes to save life and function. For seniors, whose resilience is already reduced, every second counts. Families should treat any sudden change in movement, speech, vision, or consciousness as an emergency and call for immediate medical help. Waiting to see if symptoms improve is one of the most dangerous mistakes. Because while you wait, the brain continues to die. Awareness of these signs is one of the most powerful tools older adults and their families have to protect independence, memory, and life itself. 4. First aid and emergency response. When a stroke strikes, every second matters. The brain cannot survive without oxygen, and each passing minute means more cells are lost forever. For older adults whose brains are already more vulnerable, quick and correct first aid can be the difference between survival with independence and survival with permanent disability. That is why knowing how to respond in those first critical moments is essential for every family. The very first rule is simple but life-saving: call emergency medical services immediately. Do not wait to see if the symptoms improve. Do not attempt home remedies. And do not delay by calling a family doctor first. Time is brain, and only a hospital with specialized stroke treatment can provide the care needed. While waiting for help, there are important steps you can take to protect the patient. Keep the person calm and in a safe position. The best approach is to lay them on their side in what doctors call the recovery position. This helps protect the airway in case of vomiting and reduces the risk of choking. Loosen tight clothing. Remove belts, scarves, or anything that may restrict breathing. And keep the head slightly elevated. Never give the patient food, drink, or medication. Swallowing ability is often impaired during a stroke, and attempting to eat or drink can cause choking or aspiration, which can make the situation worse. If the person is unconscious but still breathing, continue to monitor their breathing and pulse while waiting for emergency personnel. In cases where they stop breathing or lose their pulse, cardiopulmonary resuscitation should be started if you are trained. If the patient experiences seizures, place a folded cloth or soft object between the teeth to prevent injury to the tongue. But do not attempt to hold them down or place rigid objects in the mouth. Keep the surroundings safe by removing sharp items that could cause injury during convulsions. One of the most valuable things you can provide to medical staff is clear information. Make note of the exact time symptoms began, because this determines whether clot-dissolving treatment can be used. If the patient has underlying conditions such as diabetes, heart disease, or hypertension, or if they are taking medications like blood thinners, share this information immediately with emergency responders. The faster and more accurately they understand the patient's condition, the quicker life-saving treatment can begin. Remember that transport to a hospital should always be done by trained medical teams, not by private car or motorbike. Emergency vehicles are equipped to handle complications that may occur during transfer. Stroke care is most effective when delivered in the golden window, often measured in minutes rather than hours. For ischemic strokes, treatment may be possible within the first few hours, while for hemorrhagic strokes, survival may depend on immediate surgical intervention. Families who know how to act quickly and correctly give their loved ones the best chance not only to survive, but also to recover with dignity. First aid for stroke is not complicated, but it must be decisive. Recognize the signs. Call for help to protect the patient, and provide essential information. These simple steps save lives. 5. Prevention in seniors. The most powerful weapon against stroke is not treatment after it strikes, but prevention before it happens. For seniors whose blood vessels are more fragile and whose bodies are less resilient, prevention must be a daily commitment. The first line of defense is maintaining healthy blood pressure. Hypertension is the single greatest driver of stroke, and it often gives no symptoms until the damage is done. Regular monitoring, either at home with a reliable device or through scheduled checkups, allows early detection of dangerous rises. Following the doctor's recommendations on medication, diet, and activity is crucial to keeping blood pressure under control. Nutrition plays an equally important role. Seniors should focus on meals rich in vegetables, fruits, whole grains, and lean proteins such as fish, poultry, and beans, limiting salt. Saturated fats and processed foods prevents cholesterol buildup and reduces strain on arteries. Hydration is also important, especially in older adults who may not feel thirst as strongly. Drinking water and healthy beverages instead of sugary drinks or alcohol helps circulation and lowers stress on the heart. Physical activity tailored to age and ability is another essential step. Simple exercises such as walking, tai chi, or light stretching keep blood moving, strengthen the heart, and improve balance, which also reduces the risk of falls. The goal is not intense training, but consistent movement most days of the week. Even 20 to 30 minutes of moderate activity can dramatically lower stroke risk. Protecting the body from extreme temperatures is particularly important for seniors. Cold weather can constrict blood vessels and cause sudden spikes in blood pressure, while hot weather may lead to dehydration and thickened blood. Dressing appropriately, avoiding sudden exposure, and staying hydrated help keep the body stable. Eliminating harmful habits is also critical. Smoking damages the lining of blood vessels, accelerates plaque formation, and doubles the risk of stroke. Quitting at any age reduces risk quickly, and within a few years, the danger drops close to that of someone who never smoked. Alcohol should be limited or avoided, as excessive intake raises blood pressure and disrupts heart rhythms. Managing chronic conditions with discipline is another pillar of prevention. Seniors with diabetes, heart disease, or high cholesterol must follow treatment plans carefully, never skipping medication or altering doses without medical advice. Consistent management keeps these conditions from feeding into stroke risk. Stress and mental health should not be overlooked. Chronic stress elevates blood pressure and keeps vessels in a constant state of strain. Relaxation techniques, such as meditation, breathing exercises, or gentle yoga, provide powerful protection. Staying socially connected also lowers stress and reduces depression and encourages healthier habits. Finally, regular checkups are non-negotiable. Seniors should see their doctor at least twice a year, or more frequently if they have chronic illnesses. These visits catch problems early and allow adjustments before a crisis develops. Stroke prevention in seniors is not about a single miracle cure. It is about building a lifestyle that consistently protects the brain. Each healthy choice is like placing a brick in a wall that shields the brain from harm. The wall grows stronger every day. You choose wisely. Prevention may seem simple, but it is life-saving. Doctor's final words. As a neurologist, my closing message to you is both simple and urgent. Stroke in seniors is not only common, it is one of the most devastating medical emergencies, capable of turning an independent life into one of dependence in a matter of minutes. Yet, despite its severity, stroke is not an unpredictable accident. It is the outcome of risks that build silently over years, and it can often be prevented when those risks are recognized and addressed. Every older adult should understand that time is the most precious factor in both treatment and prevention. In the event of symptoms, every second counts, because brain cells cannot survive long without oxygen. Quick action can save not just life, but also quality of life. In everyday living, consistent choices in diet, exercise, medication management, and social connection can dramatically lower the odds of stroke striking at all. Think of prevention as an investment in your future independence. Choosing water instead of alcohol, a walk instead of an afternoon nap in front of the television, a vegetable-filled meal instead of processed food, or taking prescribed medicine instead of skipping doses may seem small in the moment, but these choices accumulate into powerful protection. Families also play a vital role. For seniors who may not recognize or admit the warning signs, loved ones must be vigilant and ready to act. Your awareness could be the reason someone you love survives a stroke with dignity rather than disability. I urge you not to ignore the hidden risks, not to dismiss early warning signs, and not to postpone healthier habits until tomorrow. Stroke prevention begins today, with every decision you make. Share your experiences in the comments below, because your story may guide another person to recognize danger and act before it is too late. Remember, stroke can take everything in seconds, but prevention can preserve clarity, strength, and independence for years to come. The choice to act is in your hands right now.